a.m. in the morning. I am a speech-language pathologist. I don't know if many of you have come across a speech pathologist in your work. Maybe you have. My primary role is working with children who have been identified with speech and language related disorders, or really closely with their families, mostly on an individual basis. But part of the work I do as well is working collaboratively with early childhood educators. So often when I'm out in the field, in your classrooms, in your preschools, and in your daycares, and I'm working with you to support. Okay, so this is the point where it all starts to change, right? So here we have a child who is at between 9 and 12 months. So if you think about a child in your program who's 9 or 12 months, what do you notice about how they're communicating? Anybody want to volunteer something?
Imitation.
Right. So they'll definitely start to imitate you, particularly with gestures and actions, like as you're singing songs. So what's different between that baby phase, the infant phase, the pre-verbal phase, and this gesture stage is they've learned to send purposeful messages. They might not be words, right? They might be some of this, right? Give me, or that. But they're purposely sending messages to you. Yes, so between 12 and 18 months, first words fill in. So it's most average for an 18-month-old child to have between 10 and 20 words. Does that fit with mostly what you're seeing for children at that age? Okay, great. They're showing some improved understanding, so you can say, show me your nose, show me your eyes, show me the duck, that type of thing. They're understanding some routine and common directions. One up, come here, sit down.
Doesn't mean they do it all the time.
Doesn't mean they do. Well, that's just it, isn't it? Yeah. Even your husband probably doesn't do it all the time. But anyways, there we go. So, and then point to what pictures and book were named, and this is when they start to imitate. Your number one strategy in your toolkit is to be down at their level face to face. One of my pet peeves when I go into a center is when I see teachers doing this. So get down to your child's level and be face to face, and that's for greeting, for talking, for playing, etc. So one, face to face. Strategy, child in the lead. What do I mean by that? Often when I see teachers interacting with kids, that we feel so much pressure to teach them something, right? This is all you can learn about this toy. If it's not following what they're interested in or what they're motivated by, they're just going to tune you out anyways. They're not going to learn from it. So kind of keeping in mind that there is a curriculum, but to follow what they're showing they're interested in first. So 2, child in the lead.
That's sort of the premise of the workshop, and I hope that at the end you walk away with a little bit different of an idea about how trauma impacts the development, how that development requires different strategies and interventions in order to be able to address the behavior problems or the difficulties in learning that you're experiencing. Scans. The first for a normal, typically developing 3-year-old. And the second for a child who's experienced extreme neglect. What do you notice about the differences between the 2 scans? Size, first of all, yeah? The density, right? So there's all these gaps and holes. So when I was talking about early on the connections that get made in the brain, those are the gaps from the lack of connection. So it's a lack of experiences that didn't allow for all those connections to be made in the brain to create that density that you see on the left-hand side.
You guys have worked with themes, like do you call it Circle Day some days, or do you ever do stuff like that? Yeah. Okay, well then you might, and so then you could do circles, and you can talk about how bread comes in circles. So you guys can keep this passing on this side, I'll pass, we have another one too. Wheat flakes first. It's sort of like rolled oats, wheat flakes, and then you get flour. So I'll pass these around, so you might talk to them and you can show them pictures and say, and that's how we get flour, we make bread from these grains. Starting to make connections with where food comes from. So there is so much fun that you can have with food, you guys. Through all the stories and the cooking and the tasting opportunities, we're teaching them to actually be better eaters.
Do we have to teach them eat with knife and fork? Make up this picture.
Well, you could, yeah, definitely. But this is another way you might just introduce foods with your little poster. And, for example, my carrots, I would ask the kids after we might have pulled the carrot out of the can, check out this poster at the farm. Can you see where the carrots are growing in this poster? And how many can we count?